Here's the catch. While SGLT2 inhibitors show promise for heart failure, their short-term benefits are more nuanced than they seem. But here's where it gets controversial. Some studies suggest these drugs may not cut cardiovascular risk in the first few weeks for hospitalized patients. Yet pooled data hints at broader long-term gains. Let's break this down. SGLT2 inhibitors, originally designed to manage type 2 diabetes, have caught doctors' attention for their unexpected ability to improve survival in heart failure patients. Yet when it comes to starting these medications right after a hospital stay, the evidence is a mix of conflicting signals. Take the DAPA ACT HF-TIMI 68 trial, when researchers gave dapagliflozin to hospitalized heart failure patients. They didn't see a major drop in deaths or worsening heart failure within 2 months compared to a placebo. However, when they combined this data with results from 2 other trials involving empagliflozin and sotagliflozin, the picture changed. Across 3,527 patients, SGLT2 inhibitors showed a meaningful reduction in early risk of death or heart failure decline. Why the discrepancy? Well, heart failure patients are often in a fragile state, hospitalized for a condition that's a leading cause of cardiac-related admissions. These patients face high risks both during their stay and in the weeks after discharge. Dr. David Berg, a key researcher in this area, explains, starting disease-modifying therapies during hospitalization could improve outcomes, but we need clearer data on SGLT2 inhibitors in this population. His trial aimed to test whether dapagliflozin, when initiated in the hospital, would safely reduce early risks. The results? A 12% lower risk of death or worsening heart failure in the combined data, though the individual trial didn't reach statistical significance. The study involved 2,401 patients, with a median age of 69 and nearly a third being women. Over 2 months, 10.9% of those on dapagliflozin faced cardiovascular events, versus 12.7% on placebo. While the short-term results were mixed, the overall trend across trials suggested SGLT2 inhibitors might still hold value. However, the debate continues. Should these drugs be routinely prescribed immediately after a heart failure hospitalization, or does their benefit only emerge over time? This is the part most people miss. The real impact of SGLT2 inhibitors might take weeks to unfold. So, what's the takeaway? If you or someone you know has heart failure, it's worth discussing with your doctor whether these medications align with your recovery goals. After all, medicine is rarely black and white, especially when it comes to balancing risks and benefits in complex conditions like heart failure. What's your take? Do you think the long-term advantages of SGLT2 inhibitors outweigh the short-term uncertainty?